You can live with HIV and AIDS. And Premier Sihle Zikalala, I'll just step out of the shot so that you can see this museum. This is the home of Gugu Dlamini, where she was stoned by the people that attacked him in 1998 in December. And you remember that also here in Durban, there's a park that is named after her to try and respect and show that Gugu Dlamini was also a person that paved the way for many HIV people in the country of South Africa, especially here in Durban, to try and make sure that they live in KwaZulu-Natal free. Because the other issue that the NGOs and the CPOs in around eThekwini, they still say that there's a problem when it comes to stigma. People are still living in fear in their areas because they don't. People don't want them to say that they've got HIV. But we'll try and get closer to the premier so that we can be able to get to the exhibition, because there's also an exhibition at Desiree in this side of the hall where the premier is being briefed by the members of this museum to try and let them know about the HIV and AIDS. You'll see that there's young people, because the other worry in the Sub-Saharan countries here, there's a worry about the young girls who get infected daily in the Sub-Saharan countries, that the number is still showing growth in these areas, as well as the worry that is also raised by South African AIDS Council is that they provide condoms to South Africans, but it seems as if South Africans don't use those condoms, and it end up showing on the numbers that the numbers of people living with HIV, the new infections also shows that they are skyrocketing in some areas, which is also a worry to everyone here in South Africa to show that it's also a problem when it comes to the HIV and AIDS in the area, and especially here in eThekwini. But we'll try and speak to the premier just to get to know the program of the day, because they will be at the Gugu Dlamini Park, where the provincial keynote will be there, and the dignitaries from the province, and also the people from the treatment action campaigns and all other NGOs. They will be briefing us in that event at the Gugu Dlamini Park. But we're still trying and get someone to speak to in relation to this. Baba, thank you very much for your time. Can you we're live on SABC. Can you just tell us, we know that you are the member of Treatment Action Campaign. Can you tell us more about the difference this year of the World AIDS Day, the importance?
This year we're saying we want to end the epidemic and the HIV, but also we want to take the issues of gender-based violence with us, because we cannot talk about the HIV and not talking about the gender-based violence and its role that it continues to do into our community. There are a lot of people that are dying because of gender-based violence, so we need to bring closer these two interlinks and these intersections. But then this year we just want to say it is not business as usual. We need to make sure that people they test, and then we make sure that we initiate them on treatment, and so that they're living longer on treatment. But then those who are not ready to take their treatment, we need to make sure, and also we keep them, give them enough counseling, and make sure in a later stage they do take their treatment. And those that are already in a treatment, we make sure they continue to take their treatment correctly, so that for that they are not transmitting HIV to everyone.
The health experts, they were telling us that they are worried about the people who default because of lockdown regulations in the country. What is your position as Treatment Action Campaign?
Lockdown really, it has actually in a way caught us with our pants down, and then kindly of undermine the way how we're responding to HIV and AIDS in South Africa. There were a lot of numbers of people that were lost to follow-up because of COVID-19, because of lockdown, and also we have seen a number of people that are defaulting on their treatment. But then ever since then, beginning of last year, then we started to ensure that we're bringing everyone who were lost to follow-up to make sure that they are brought back into the healthcare system to make sure that they take their treatment correctly.
Thank you very much for your time.
Pleasure is all mine.
Asmo, that was the treatment action campaign here in KwaZulu-Natal, briefing us that people, they also worried in relation to people who are defaulting from taking their medication because of stricter lockdown regulations in the country. Back to you, Desiree, in studio.
Of course, we'll continue to follow up on that story.